public and private organizations focused on promoting hand washing with soap, and we are thrilled to be convening this webinar today with our partners at USAID ahead of Global Hand Washing Day. We'll move into our great program in just a minute, but first a few logistical notes. As you can see, we're using the Adobe Connect platform. All participants' microphones are muted, so if you are a participant, we cannot hear you, but you can type your questions and comments into the chat box on the lower right-hand corner. My colleague Bijan, who you'll see in the chat box asking you to introduce yourselves, is managing our technology today. So please chat to him throughout the program if you have any technical questions. We have an hour together for our webinar today. And just to let you know how we'll move through this, we have two great presentations, which I'm really looking forward to and hope that you have some great questions on. So we'll run through those two presentations first, and then followed by some time for discussion. So if you have questions while the speakers are presenting, please feel free to ask them, but we'll address them at the end after we've been through both presentations. Now I'll turn over to our moderator for the day, Ngyuen, who's a senior water, sanitation, and hygiene and social behavior change specialist at USAID and a great hand washing champion. So over to you, Na.
Hi, good morning. Can you hear me?
Yes, we can hear you.
Okay, great. Thanks, Caroline. It's great to be here. We have an amazing number of people registered today, over 200 people from across the world, from various sectors and backgrounds. I think this is a great indication of the high level of interest that there is in behavior change and in hand washing in particular. And as we all know, changing behavior is very challenging. And there's different ways to approach changing hand washing behavior, whether we're using more environmental cues that trigger systems one. Systems one is the emotional subconscious thinking, or we're approaching systems two, the more rational approaches. So we thought we would bring together two great speakers today to present to you two approaches to changing behavior that actually have worked and changed and improved hand washing rates. So our first presenter is Dr. Reshmaan Hussam, and she will be speaking about using nudges and rational habit theory. Dr. Hussam is currently an assistant professor of the business administration at the Harvard Business School, and her research explores questions that are at the intersection of development, behavioral, and health economics. Especially interesting to her is the puzzle in development economics of the ubiquitously low adoption of many low-cost, high-return behaviors and technologies in the developing world. She'll be followed by Dr. Hans Mosler, which many of you may know. He has been working in the WASH sector for many years, and he will be speaking about the RANUS model and its application in designing hand-washing programs in Zimbabwe. Professor Mosler is an environmental and social scientist, and he spent many years studying human behavior as it relates to health issues in developing countries. His studies focus on how behavioral factors into the successful implementation of water and sanitation projects, and they've made him an expert in the implementation of strategies for positive and lasting social change. Dr. Mosler is currently a senior researcher and group leader at the EAWAG, which is the Swiss Federal Institute of Aquatic Science and Technology. So with that, I'd like to ask Dr. Hussam to go ahead and begin her presentation.
Great, thank you so much, Na. And thank you so much for having me. I'm really excited to share this study with you and hear all of your feedback and questions and thoughts. So the presentation is just coming up, and this is a project on hand washing and habit formation with my co-authors Atana Rabbani, Giovanni Reggiani, and Natalia Regal. So let me just get it. All right. Okay, so I don't need to explain to this audience why hand washing with soap is very important. The World Bank calls it the most effective vaccine against childhood infections, and yet we find that these hand washing rates are so low worldwide, especially during critical times. And the critical time that I'll be focusing on in this project is just before eating. So why is this? Well, the thing that we usually jump to as economists, as social scientists, as people in the public health world as well, is perhaps people don't know. Perhaps there's a scarcity of information. They don't know it's important to wash. But this doesn't seem to be the case. Across the board, information interventions, for the most part, haven't worked in changing behavior. And in our context, which is rural West Bengal, people believe it's important to wash. So if you ask households, what's the difference? Is there any between washing with soap and water or just water? And if so, what is it? So, many of them will say, actually it's 87% say, yes, there's a difference, and the difference is that soap cleans out germs, kills germs. And so they seem to have quite a sophisticated understanding. So information doesn't seem to be the magic bullet. Perhaps it's that they know, but they have a scarcity of resources. But this too doesn't seem to really fix the problem. So resource interventions where people give soap and make it easier to have access to water, including our own, we've done this in West Bengal, haven't worked in changing behavior sustainably. In our setting, 99% of households have soap, and all of them have access to potable water. It's West Bengal with a high water table. And yet, still, they are not washing. Okay, so perhaps they know and they have the resources, but they actually know that in the environments they're in, their high pathogen environments, hand washing alone is not useful. But again, in our setting, I'll show you in the results that we find that just changing hand washing behavior, keeping everything else constant, significantly reduces ARI and diarrhea, and this translates into significant improvements in weight and height for children. And yet people still don't wash. So only 14% of mothers will self-report washing their hands with soap. Not every day, not before every meal, just at all. And you can imagine this is a significant overreport since it's a self-report. All right, so the features that I'd like to focus on in this project are three. The first is that hand washing is a preventive activity, which means that the returns aren't salient, right? They're not manifested, they're prevented. Second, it's not a social norm. The people around you aren't doing it, which means you don't face any persistent social costs to shirking on the behavior. And lastly, and I think most importantly, it's a repetitive activity. You have to wash regularly in order to gain the benefits, but this sort of engagement can be costly unless the behavior becomes a habit. And this comes straight from our respondents. If you ask these women in these households, why don't you wash your hands with soap? 56% of them will say, very literally in Bangla, they say, abhash nai, which means I don't have a habit. Another 20% say they forget. Another 10% say they don't have time, or the remainder say I don't have time. So it seems to be within the behavioral context that this issue is falling. And I want to quickly highlight that even though this talk is about hand washing, I think these features apply to many health activities that we care about increasing the adoption of. So water treatment, latrine use, clean cook stove use, etc. Okay, so very quickly, the conceptual framework that I'm going to be using is one that appeals to economists but might not appeal to others, and I can see why. But it's based on the seminal paper by Gary Becker and Kevin Murphy called A Theory of Rational Addiction. Now, I'm not going to be pushing the addiction phrase. I'm going to be using the term habit formation for what they call addiction. And the mechanism behind habit formation is this idea that it's a behavior that has intertemporal complementarities in the utility from consumption, which simply means that the more I've consumed in the past, the more likely I am to consume today. My behavior in one time period affects my behavior in another. And a rational habit former is somebody who recognizes this. So a rational habit former recognizes that changes in my future likelihood of consumption will actually affect whether or not I consume today. And I think the most intuitive way to think about this is, for example, a smoker. Imagine I'm addicted to smoking, or I have a habit for smoking, and I know that tomorrow I'll be somewhere where I have no access to cigarettes. It'll be impossible for me to get any cigarettes. Then, being a rational habit former or a rational addict, I may withdraw my consumption of smoking today because I know the price of smoking tomorrow. Okay? So what do we do in practice? Well, the way we implement or test this theory in the field is we have a randomized control trial among 2,900 rural households with young children in West Bengal, and our experimental design randomizes 2 dimensions. The first is whether these households receive monetary incentives, social incentives, only a dispenser, or no intervention at all for daily hand washing. These are going to be temporary interventions, but we're going to follow these households' hand washing behaviors over a long period of time. And so if we see persistence, that's consistent with the story of habit formation, that this behavior is a habitual behavior. The second thing we're going to randomize is whether these households anticipate these monetary incentives or the social incentives. So what this does is it allows us to change the future value of hand washing, keeping your current value constant. And the only reason you would respond today to a change in the future value is if you're rational about the habitual nature of the activity. And the data we're going to collect is very precise measures of hand washing behavior, willingness to pay for soap, and child health data. Okay, so we worked with the Media Lab to develop this sensor technology to measure hand washing behavior. And the reason we did this is because, as I'm sure many of you know, the standard ways to collect hand washing outcomes are either self-reports or by enumerators observing the cleanliness of your hands or observing presence of hand washing stations. And you can imagine there's a lot of bias in these outcome measures. There's a lot of noise, and it's hard to, it's difficult to capture the, it's difficult to capture the actual habit formation dynamics without the precision of a sensor. So this sensor is going to be a time-stamped sensor embedded in the dispenser. You can see it here in the field. We put it in the veranda, which is where most of these households eat their dinner or eat their meals, at a height accessible to these young children. That child is 5 years old. So he presses that button, gets that foamy soap. The sensor records exactly when he pressed and how long he pressed, or how many times he pressed. And then he goes and he rinses his hands off in the nearby shallow tube well. And the primary outcome we're going to be using in the results I show you is a binary measure of whether that dispenser was active during the family's self-reported mealtime. And just briefly, we want to maximize the possibility that this can become habitual. So we put it inside this habit loop, where the trigger is going to be that evening mealtime. The routine is hand washing, and the feedback will vary based on what intervention you're in. Okay, so what's the design? So the design is as follows. We have a full sample of 2,900 households, and that's going to be across 100 villages. And we're going to randomize the villages into incentive villages and monitoring villages. And all 2,900 households will be visited once every 2 weeks to collect child health data and also hand washing data. So what do incentivized households receive? They're going to get a calendar. They're going to get their dispenser, which is theirs to keep forever. They'll get soap for a year for free. They're going to be told that the dispenser tracks their behavior, and they're going to be, that behavior will be marked on the calendar. So every night that they wash correctly, they get a check. Every night that they don't, they get an X. And in addition, they're going to get tickets. For every check that they get, they either get 1 or 3 tickets based on which treatment arm they're in. And those tickets can be redeemed for various prizes. Okay, so what happens in these incentive villages? Well, within the incentive villages, we randomize at the household level across 4 groups. You have the pure control group. They get nothing. They're just, they are who they are. You have a group of households who get that full package I just described, where they get 1 ticket for every night that they wash correctly over 4 months. So 2 months plus 2 months. So over 4 months, every night that they wash correctly, they get 1 ticket. Another group gets 1 ticket for the first 2 months, and they're told at the beginning of the experiment that starting in month 3, they will get 3 tickets for every night that they wash. So this allows us to exogenously increase the future value of hand washing while keeping the current value constant. And finally, you have the group that gets 1 ticket now. They assume they're going to get 1 ticket for 4 months. But starting in month 3, we come to you and we surprise you and we say, hey, we have extra tickets, so we're going to give you 3 tickets for every night that you wash correctly. And so if you compare the anticipating groups to the surprised groups, in the early months, any difference in behavior is purely due to anticipation, which suggests that households are indeed rational about their habits. Okay, and like I said, we also have monitoring villages. Well, who are monitoring villages? Well, when you're a monitoring household, you get everything that the incentivized households get except for the tickets. Okay? And so we have a parallel experiment running in these monitoring villages where you have the peer control guys, they get nothing. You have households that get have the dispenser and just go on their merry way for 4 months. They don't know they're being tracked. They're just using the dispenser as is. You have households who have the dispenser, but they're told that at month 3, they will start being tracked. We're going to turn on this switch in the sensor, and we're going to start recording your behavior on your calendar. So they anticipate this social incentive of monitoring in the future. And the last group, they don't know they're being tracked. They don't think they're going to be tracked. And then come month 3, we come to them and say, hey, we're going to start tracking your behavior and recording your behavior on this calendar. So they're surprised. So comparing anticipation and surprise, again, gives us whether or not individuals are rational about the habit-forming behavior. Okay, so the results. So first, let me show you the contemporaneous effects. Were we able to increase hand-washing rates at all? Seems we were. So here, the blue line, you see, the dispenser control guys. They just got the dispenser. They weren't being tracked. They didn't get incentives. The red line are the guys with the full package. They have the dispenser, the monitoring, and the tickets. And you can see that as time progresses, hand-washing rates increase significantly. It's 70% more, at points over 100% more. And you can also see those red dashed vertical lines are when we visit the household to deliver the tickets to collect their child health data. And you can see that households are responding, especially when we visit, which I guess you can expect. And is some sign of, what we could think of as a numerator bias. So it's nice that we have this time series and you can actually see their true behavior, not only when we visit. Okay? So that was the effect between households who got the full package and those who got nothing. How about between households who got 1 ticket versus those who got 3? Well, it seems there was actually no effect. So here, before the dotted line, both households are getting 1 ticket. After the dotted line, the vertical dotted line, the red households are getting 3 tickets. The blue households are getting 1. And really, you see no effect. So tripling of incentives, to our own surprise, didn't seem to do much of anything. How about on the monitoring side? So here, before the vertical red dotted line, both households are just going on their merry way with just the dispenser. Afterwards, the red households start being tracked on their calendar, while the blue households continue on their merry way. And you can see that monitoring did have a significant effect. It's about a 40% effect, in fact, of the monitoring intervention. Okay, well, how about persistence? So recall that these are all temporary interventions, but we track you even after. So did the behaviors persist, or are these behaviors habit-forming? So here I'd like you to compare the blue households, who are dispenser only, versus the red and green together, who got those incentives. So before the dotted line, the blue households only have the dispenser, while the red and green get incentives. Afterwards, they're all the same. None of them get anything. They just go on their merry way. And you can see that while both households, the rates are declining, the slope is negative, the gap remains. And so households who are formerly incentivized continue to wash more. So this does seem to be a habit-forming activity. Now, how about between the guys who got 1 ticket formerly and the guys who got 3? Well, recall that that didn't change behavior contemporaneously, so of course we shouldn't see any persistence. So you see the green and the red lines kind of just fall on top of each other. Well, how about the monitoring guys? Before the dotted red line, the blue households weren't monitored and the red households were monitored. After the dotted red line, neither households were tracked. And you can see that households that were formerly monitored continue to wash more. So again, it seems consistent with the story of habit formation. Okay. So how about the rational habit formation effects? Recall that we weren't able to change behavior between 1 and 3 tickets contemporaneously. So of course, we shouldn't expect that there's any change in anticipation. So that's exactly what you see here. The lines fall right on top of each other. However, we were able to change contemporaneously the effect of getting monitored. And you see that, in fact, households who anticipate being monitored, which are the green households in that gray box, are washing more even before they start getting monitored. So that suggests very strongly that households are, in fact, rational about the habit-forming nature of a behavior. Okay, and finally, child health effects. So here I just show you the effect of receiving a dispenser at all, you pooling across all those treatments, compared to being in that pure control. And you see that just within 8 months, we found a 30% decrease in diarrhea rates, a 17% decrease in respiratory infection. These are self-reported, so you might worry that there's bias, but it translates into significant improvements in anthropometric measures. So you see a 0.2 standard deviation increase in child height for age, and in exactly the age that you'd expect, which is younger than 2. It's quite large. So just to summarize, what have we found? We found that hand washing alone does have substantial impacts on child health, so we should care about it. And both financial incentives and social incentives do increase hand washing. But the broader lessons, I think, are number one, that this behavior is habitual, which means that the optimal scheme, if you are thinking of an incentive scheme, is to front load incentives, to put a lot of incentives at the beginning, and that has persistent effects later on. And finally, that agents are rational about this, which means anticipating a future increase actually increases your likelihood of washing today. So an optimal scheme could be to delay and announce delivering incentives rather than delivering them immediately, and this can have long-term effects. All right, my time is well over, so thanks so much.
Fabulous. Thank you, Dr. Hussam. That was actually a great presentation of a very tidy study that's able to show us that with certain interventions, hand washing behavior can be changed, and that people can develop a hand washing habit. And then as a result, the habit can lead to reductions in diarrhea, ARIs, which then can lead to improvements in nutritional outcome. So I think the study is fascinating because it takes us through an entire chain, this entire theory of change whereby you improve hygienic behavior and then it ultimately leads you to health impact. So thank you so much. And now I would like to turn it over to Dr. Mosler, who's going to present his research in quite a different context, which is urban Zimbabwe. Take it away. Dr. Mosler, I think there's, we can't seem to hear you.
Can you hear me now?
Yes, we can hear you now. Okay, the technology is working for us. Maybe if you could start from the beginning, please.
Yes.
Right,
sorry.
Okay.
Okay. I hope we all agree that behavior change starts in the head of the people. And head means that there are factors in the mindset of persons where we want to elicit behavior change. And these factors are, for example, knowledge, health knowledge, but also perceived social pressure or beliefs about costs and benefits or whatsoever. We will see this in more detail. And, And we also have to realize and make use of the fact that there's a difference between the doers and the non-doers. Here you see the doers drinking safe water, and here you see the non-doers not drinking safe water, and you see they are deficient in factor C and B, indicated by C- and B-. So as a first step, we need to have an idea which are these factors. We have to identify these behavioral factors. Then we want to measure and calculate the differences between doers and non-doers. Then we select the behavior change techniques accordingly, and accordingly means that according to the factors which are deficient in the non-doers, we select the behavior change techniques. So we want to change C- and B-, but not A. Yes? Then, okay, we design and implement this software, and then we also monitor change in behavior, of course, but also change in behavioral factors. Did we really change C and B? Okay, this you can arrange to a systematic approach with 4 phases. You first identify the behavioral factors. We do that with a qualitative survey and the runners model. Then we know the factors to be tested. Then we measure and determine the behavioral factors with a quantitative survey and the doer-non-doer analysis. Then we know the behavioral factors which should be changed. Then we select the behavior change techniques and design the strategies. For that, we have a catalog of behavior change techniques. Then we know which behavior change techniques to apply. Then we implement and evaluate the behavior change strategy with a before-after control trial, and then we have the best behavior change strategy to apply at scale. I will go through that step by step. But before I do that, let us jump into a promotion situation. Imagine you are standing here behind this desk and you are promoting chlorination of drinking water. Before you begin to talk, what will you say? You have to think about what these people think. And this might be, am I at risk? Why? How to do it? What does it cost? What does it bring to me if I apply it? Do I like it, drinking chlorinated water? What will others say? Can I do it? And how to manage it in the daily life? And these thoughts about the behavior can easily be arranged into this model about risk, attitude, norms, ability, and self-regulation. And you see here in the center of the model, these are the drivers of behavior. It's not only norms, it's not only attitudes, not only risk, but also abilities and self-regulation. Self-regulation is very important for habitual behavior. Risk factors are a person's understanding and awareness of the health risk. Then attitude factors are a person's positive or negative stance toward a behavior. Norm factors represent the perceived social pressure. Ability factors are about the confidence in a person's ability to practice the behavior. And self-regulation is about the attempts of a person to plan and monitor a behavior and to manage conflicting goals and distracting cues. On the right side, you have always 2 behaviors or even more. You have the behavior you want to change, and you have an alternative behavior. Drinking disinfected water, drinking raw water. On the left side, you have behavior change techniques from which we know that we can change these behavioral factors. And we have moderating social, physical, and personal context. I come to the case study. It's about design, implementation, and evaluation of a hand-washing campaign, as I said, in peri-urban Harare, and in the Masvingo province of Zimbabwe. In this first step, we do a qualitative survey with qualitative interviews. How readily available is water? How readily available is soap? We do some spot checks. What are the local hand washing facilities, and so on. We then arrange that into the RANAS model, where we fill the RANAS factors with contents, with local adapted contents. Okay, we now come to measure and determine the behavioral factors. First, we do it with a quantitative survey. We use a standardized questionnaire. You see that this is self-reported hand washing. Come back to that later. And you see, well, let's say others' disapproval, a norm factor. People who are important to you, how much do they think you should always wash your hands with soap and water? Not at all, from 1, not at all, to 5, very much. We do that in face-to-face interviews. Then we perform the doer-non-doer analysis. We do a classification based on behavior. Here it is self-reported, hand washing, frequently done, that's the doers, and not frequently done, that's the non-doers. And we have a score for each answer of each person on perceived effort and on others' approval. And you see that for perceived effort, there's not a big difference between doers and non-doers. So we don't have to target this factor. And here, in the score and others' approval, the mean score and others' approval is quite different between the doers and the non-doers. So we have to tackle exactly this factor. So we know now the behavioral factors which we have to change. Now we select BCTs and design them. We have a catalog of 36 behavior change techniques. Here you see only the last ones, yes? For barrier planning, prompt coping with barriers, for example. For remembering, use memory aids and environmental prompts. By the way, environmental prompts are nudges. Or for commitment, prompt goal setting, just as to mention some examples. And in the case of the case study in Zimbabwe, strategy 4 was about to change the perceived behavior of others. We used the slogan, hand washing of course, we all do it. That is about others' behavior. As communication channel, we used an interpersonal communication channel, a community meeting, and we prompted a public commitment. The participants came in front of the community and shout out the slogan as sign of their commitment. And this looked like that, yes? This is the public commitment. And additionally, there was to organize social support. Then there were many, but just one more example. This is behavior change technique 26, prompt specific planning, when, where, and how plans. And you see these icons, these are plans when to wash hands. Okay, let's look at the evaluation. Change in, oops, what is that? Oh, it's not displaying. It's not displaying my graphic. Neither here nor there. Okay, then I have to explain. Well, we changed observed hand washing with soap. And we changed it differently for hand washing before contact with food or hand washing after going to the toilet. And we changed the observed hand washing for, let me look at that, nearly 40%. It increased by 40%, the observed hand washing with soap. But more interesting, and you can see that, is that there would be a change, there's also a change in the psychosocial factors. and exactly in the psychosocial factors that we targeted at. We also changed others psychosocial factors, but the right ones, which we really targeted at, we changed also. Okay, this is okay. To conclude, systematic behavior change using this approach enables you to exactly determine the behavioral factors you need to change. And then you can have a focused selection of the behavior change techniques, the ones which you really need. The ones which you really need and the others you don't need. And with this approach, you have also a proven record of success. We have compiled the approach in a guideline, which you can retrieve from our homepage if you are interested. There are several case studies in examples. Simply have a look at it, and if you are interested, you may contact me. Thank you for listening.
Fantastic. Thank you, Dr. Mosler. I sort of am sure, can everyone hear me? Yes? So I think that was a great example of how we use theory as well as evidence-based programming to design programs that actually change behavior. And I think what practitioners will appreciate is in your last slide, you give us an introduction to a practical guide in using the Radness approach in designing future hand washing programs. So with that, I would like to open up the floor to some questions. So if you haven't typed in a question, please go ahead and do so now. During the presentations, we did receive a couple of questions already. Dr. Hussam, maybe we could start with you. So someone chimed in, it's great to see a success story for changing behaviors, but I am interested in the author's thoughts regarding what the cost would be to scale up the BC approach plus incentives to the entire country. And a follow-on question would be, I would also be interested in Dr. Hussam's view on environmental cues to sustain the habit. Was the dispenser considered the only cue? Okay, and the last question is also related to the same study, is that you tested the intervention for habit formation after 140 days. And what are your thoughts on sustainability of the intervention after 140 days? So if we could just start with those, and then the other participants can go ahead and chime in with your other questions. We'll take those.
Great, thank you. Those are all very important questions. So on the scalability, I wanted to think of this project as a mechanism experiment. So really trying to understand what are the underlying mechanisms driving this low adoption? And I didn't want to design it as something that's immediately policy implementable or scalable. So, even if somebody asks me what's the policy recommendation you can get from this, I think it's tricky. For example, those dispensers with the sensors, those aren't cheap. Each one costs $30. So for sure, you can't scale that. The incentives too, those tickets, they're sufficiently cheap. Probably actually, that was actually remarkably effective, and they're quite cheap. Each ticket is worth a nickel, and triple tickets don't do anything, so a single ticket is enough. So that could actually be something that's not such a crazy intervention. But really, I don't want to recommend those things as the scalable things. Really, I wanted to push this as these sorts of sensors give us insight into exactly what's going on in these adopters' minds, and then we can think about how to structure incentives in a much broader framework, not just financial incentives. They can also be these social incentives. As Dr. Mosler showed, it seems like the social norms thing is quite important. So we could push that dimension, and I'm very interested in exploring some projects where we do push that as the real incentive that we use. One last thing I wanted to say about scalability, though, is even though I don't think these sensors are useful for much more than research at the household level, I do think that they can be very useful, actually implementable and scalable at institutional levels. So for example, at a school or at a hospital, where you would imagine there could also be much larger health spillovers, positive health spillovers to change because there's a concentration of people in those areas. You can also use them in those cases to do more than just monitor hand washing. You can use it to actually monitor attendance, for example, and actual activity in those spaces. So that's just a side thought. On the environmental cues, we wanted to, so one thing that was very nice when we asked households whether or not they liked the dispenser and why, a lot of the households came back and they said, I like it because in Bangla they say chokhe pare, which means it falls upon the eyes. And so we wanted to put the dispenser in a place where the cue could be easily kind of recognized, which is exactly in the veranda right when you're gonna eat. So we wanted to make it amenable to the environment as a whole. So yeah, so there's that. And the persistence, this is definitely a question I get a lot because when one thinks of habit formation, one thinks of behavior plateauing and being stable. And I just want to push that, I think habit formation in its essence is really just that something I did yesterday, I'm more likely to do today. So we do see that, and it might be. So we track households for longer than 8 months. I just haven't looked at the data yet, so that data is being processed right now. And as you guys observed, the slopes are negative, right? They're potentially converging. So it could be, I haven't seen the data yet, but it could be that, come 1 year later or 1.5 years later, everybody has gone right back down to zero. But I don't think of that as a hopeless case because now we understand that front-loading incentives does have persistent effects. So maybe what we need to do is make those incentives stronger or allow them to last longer. But at least, it's a step in that kind of right direction in understanding how to design the incentives.
Great. Well, thank you, Dr. Hussam, for answering the questions, but also being straightforward and honest about the limitations of the study. What I'd like to do now is we have a series of questions for Dr. Mosler. We have 3 questions for you. So number 1, could you briefly describe the process for developing or adding the BCTs to the RANIS catalog? I would be interested to know how they accord or differ from Susan Mischie's BCT catalog and what criteria, are used to arm this methodological tool belt. Okay. The second one is, have you identified any factors which appear to influence hand washing with soap in most settings, i.e. universally relevant factors, or do those factors differ widely from context to context? And the final question for Dr. Mosler is the quantitative survey on behavioral factors applied during household surveys? And what is the recommended context to apply these complex surveys?
Yes, thank you. The first question, I'm sorry, there was one slide missing, but we can use this slide here because the differences between the doers and non-doers in these behavioral factors, where the differences are bigger than 0.5, this is a rule of thumb. These factors have to be tackled, and from these factors, we look at the BCT catalog and say, okay, we should use BCT, I say 25, for example. And the difference to the catalog of Mickey is that there's more environmental psychology therein, and environmental psychology is also about how to bring people to save energy and so on. So it's different, but some of our BCTs come from the Susan Mickey's catalog. The second question was about the universality of relevant factors. We have now data about 8 or even 10 countries about hand washing. And what we see, surprisingly for me, that always the social norm factors, they are relevant. But it differs also from country to country, and I think it is worthwhile to perform a survey and do this doer and non-doer analysis, because then you know which are really the factors, the relevant factors for your target population. Then the third question are these household surveys? Yes, these are household surveys, and these are like CAP surveys, knowledge, attitude, practice surveys. If you perform CAP surveys, you can perform runner surveys. That's an easy thing, and it's not a complex survey. Look at our guideline. There you have examples, and it can be easily done. And there was a fourth question which I have noted, but you see the results here in this slide about the evaluation in change in observed hand washing before and after the intervention and compared to the control group. Yes? Okay, thank you.
Great. Those were great questions. Thank you for chiming in. And now I have one question for both presenters. What would the authors say are the key takeaways for participants to consider as they design their own hand-washing behavior change initiatives? Either speaker could take the question whenever you're ready.
Yes. My take-home message is take into account all the relevant behavioral factors. Take into account all these factors and not only health knowledge. Yes? And the second is perform this doer, non-doer analysis, because this gives you out what you should do, what you should apply when you implement your behavior change communication. Thank you.
I'd like to say I really agree with both of the things Dr. Mosler said. I think those are extremely important. And then also, I guess the two things that I'd like people to take away here are, and this is not just in hand washing, but in so many of the preventive health behaviors we think about, we do need to think much more about measurement, because if we really want to get at the underlying mechanisms, we need to have more precise measures of these outcomes that aren't subject to the bias and the noise that the typical ways of measuring are. And second, that we can be creative about incentives. When we talk about incentives, it need not be financial, monetary incentives. But however we talk about incentives, we do need to think carefully about how they're structured in time. And that giving incentives at one time period can be very different in its long-term effect from giving it at another.
Okay, great. Thank you so much. Well, I think we've seen through this webinar two very different but also effective approaches to changing hand washing behavior. And I think although they're quite different, they're not mutually exclusive, right? And that we could, as practitioners, think about using components of each of these approaches. So when you're thinking about nudges, incentives, you still need to know your audience through research. You still need to identify the barriers, and you need to decide which cues or incentives are necessary. So I think we are about ready to wrap up, but before we conclude, I'd like just to make two quick announcements. As many of you know, October 15th is Global Hand Washing Day. So on that day, millions of people participate in events and programs, online campaigns to advocate for the importance of hand washing. This year's theme is Our Hands, Our Future. which emphasizes the multiple benefits of hand washing in health, education, equity, and more. So we hope that you've learned some useful tips on this webinar to support your Global Hand Washing Day programs. And it's not too late to plan a celebration. You can go to globalhandwashingday.org to find tools and resources. The second announcement is that we at USAID are excited to announce the launch of globalwaters.org, which is an online knowledge resource for partners, USAID staff, and the broader water sector community. So this site will connect people to the latest resources and ideas to help solve global water and sanitation challenges as USAID and its partners work towards a healthier, more water secure future for all. So you can go on the website and suggest new materials for the site, such as stories, reports, videos, blogs, toolkits, events, or webinars that you'd like to see and you're interested in. And in addition, I also wanted to mention that we will have a blog recap and recording of this webinar available on the globalwaters.org. So that's www.globalwaters.org. We'll also be posting the slides from this webinar on there. So thank you so much for participating, and we hope that you will join us for future webinars and join us for Global Hand Washing Day. And finally, after this webinar, we will have a quick survey, and it's about 6 questions. We would really love your input on how useful you found this webinar, and also what your ideas are for future webinars that we could pick up and find more researchers and practitioners to share the great knowledge. Okay, have a great day. Thank you very much.